Welcome to the deep dive. Today we're tackling a subject that, well, it's natural, but can sometimes become incredibly challenging, even frightening for pet owners.
hmm
Difficult birth, or what's medically known as dystocia, in dogs and cats.
Exactly.
We've gathered quite a bit of information from veterinary sources, and our goal today is really to understand, why this happens, what the key danger signs are, and how it's typically handled.
Yeah, and when we talk about difficult birth, it's not just one single thing. It can crop up at pretty much any point during labor,
Right.
and the root cause could be with the mother, maternal factors, or with the puppies or kittens themselves, the fetal factors,
Yeah.
or sometimes it's a bit of both. It's often complex.
Okay. So to kind of set the stage, let's quickly touch on what a normal birth generally looks like.
Good idea.
Our sources indicate that puppies and kittens usually come out either head first or sometimes tail first.
That's right, anterior or posterior presentation.
And they're typically lying sort of on their backs, dorsosacral position, I think it's called,
Yeah.
with their head and little feet extended. Seems pretty straightforward.
Generally, yes. And then there are the three stages of labor everyone talks about.
Okay.
In dogs, stage one is all about the uterus starting those contractions and the cervix beginning to relax and open up. This typically takes, say, 6 to 12 hours.
Mm-hmm.
Although it's interesting, for nervous first-time moms, it can sometimes stretch out quite a bit longer, maybe even up to 36 hours.
Wow. Okay. Hey, cats.
Cats can be a bit different.
Mm-hmm.
In that first stage, they might be quite vocal initially. Then often as things progress, they might actually start purring and seeking out contact, becoming quite social.
Interesting contrast. So stage two.
Stage two is delivery time. This is when the puppies or kittens actually make their appearance.
Right.
For dogs, you generally expect to see that first puppy within about 4 hours of stage two really getting underway.
Up.
After that first one, the others usually follow every 20 to 60 minutes or so, though occasionally you might see a longer gap, perhaps up to 2, maybe even 3 hours between pups.
And cats again. I hear they're different.
Oh, very different, potentially. The average duration for stage two in queens is around 16 hours.
16.
Yeah, but the range is huge. It could be as short as 4 hours, or it could stretch out to 42 hours.
42.
And believe it or not, in some cases, it might even extend up to 3 days and still be considered, well, within the realm of normal for that particular cat.
That really highlights how variable it can be, especially for cats.
Absolutely. It really underscores why knowing your individual animal is so important.
Hmm.
And then quickly, stage 3 is just the delivery of the placentas, the afterbirths.
Right.
And this often alternates with stage 2 when there's a whole litter coming. A pup arrives, then maybe a placenta, then another pup. That kind of pattern.
Got it. Okay, so that's the baseline for a typical birth. Now let's get into when things go off track, dystocia. One of the first things that jumped out from our research was the incidence rate, how often it happens, and how much it varies by breed.
Yeah, it's actually surprisingly hard to get firm numbers for dogs. Part of that is due to, when people decide to intervene and just general variability.
Okay.
But in cats, we have slightly better data. The average reported incidence seems to be somewhere between about 3.3 and 5.8%.
And there's a big difference between mixed breeds and purebreds, isn't there?
A massive difference. Mixed breed cats seem to have a really low rate, maybe around 0.4%.
Wow.
Whereas in pedigreed cats, it's way higher. It can go up to like 18.2% in some breeds, like the Devon Rex.
18%. That's almost 1 in 5.
It's a significant number.
And it's not just cats, right? Certain dog breeds are also much more likely to face difficulties.
Definitely. You see it in miniature and small breeds sometimes,
Correct.
where you might have a small litter, but the individual puppies are relatively large for the mum size. Larger breeds aren't immune either. They can have issues, especially with, say, a single very large puppy, or sometimes just massive litters that exhaust the uterus.
And conformation, the dog's actual build, plays a big role too.
Oh, absolutely.
Yeah.
Brachycephalic breeds, the ones with the shortened muzzles and often broader heads.
Like bulldogs, Boston Terriers, pugs.
Exactly those. They often have that combination of a wide head needing to pass through a relatively narrow pelvis. That's a setup for trouble.
Makes sense.
And also breeds where there's just a known mismatch between the typical fetal head size and the maternal pelvis size. Think Sealyham Terriers, Scottish Terriers.
Okay. And then there's this thing called uterine inertia.
Yes, that's a really common cause.
Yeah.
Basically, the uterus muscle just isn't contracting effectively. It either doesn't start properly, that's primary inertia, or it starts okay but then just fizzles out, gets tired, that's secondary inertia.
And some breeds are more prone to that specifically.
They seem to be. Our sources mention Scottish Terriers again, Dachshunds, Border Terriers, Aberdeen Terriers, even Labrador Retrievers.
Huh, Labradors too.
Yeah, and then there's a wider list of breeds, just generally noted for higher dystocia rates overall. Chihuahuas, Dachshunds again, Pekingese, Yorkies, miniature poodles, Pomeranians. Quite a few of the smaller breeds.
And back to cats quickly, similar patterns there.
We see it again with the brachycephalic types, like Persians and Himalayans, and also, interestingly, the more slender-headed dolichocephalic breeds, like the Devon Rex we mentioned earlier.
So the takeaway is breed predisposition is a really significant factor for you, the listener, to be aware of if you're involved with these animals.
Absolutely crucial information.
Okay, so we know who might be more at risk. What are the actual warning signs? What should someone be looking for that says, hang on, this labor isn't going right?
History, the timeline, is super important here. One big red flag is seeing the mother having strong, persistent abdominal contractions, really straining for more than 30 minutes without a puppy or kitten emerging.
30 minutes of hard pushing with no result.
Yeah, right. Also, specifically in dogs, if it's been more than 4 hours since stage 2, that active pushing stage clearly started and still no first puppy. That's a concern.
4 hours from start of pushing to the first pup?
Yes. And then between puppies and dogs, if more than 2 hours pass, that's also generally considered too long and warrants checking out. Sometimes up to 3, but 2 is a good rule of thumb for concern.
Got it. What about signals before active labor even starts?
Yeah, there are a couple useful indicators, particularly in dogs. If labor doesn't kick off within 24 hours after her rectal temperature drops below about 99 Fahrenheit, or 37.2 Celsius, or if it doesn't begin within about 36 hours of her serum progesterone level dropping below 2 nanograms per milliliter, those are signs that things might be delayed, and you should seek veterinary advice.
Hormonal and temperature cues.
Exactly. And also, just observing the mother. If she seems to be in excessive pain during contractions, crying out, maybe frantically licking at her vulva that's not typical, that could signal a problem.
Okay. And the overall length of the pregnancy itself, when does it become overdue?
Good point. In dogs, if the pregnancy goes beyond 72 days from the first mating, or more than 59 days from a specific point in the cycle called cytologic distress day 1, or over 66 days from the LH peak, those are generally considered prolonged gestations.
Right.
For cats, the benchmark is usually considered over 68 days from mating. These prolonged times can sometimes mean something's holding things up.
Okay, those are the historical clues, the timeline things. What about actual physical signs someone might see during labor?
There are a few key ones. A greenish-black vaginal discharge, which is called uteroverden. It comes from placental separation.
Okay.
If you see that more than 2 hours before the first puppy or kitten is born, that's a potential warning sign of placental detachment happening too early.
Got it. Greenish-black more than 2 hours before the first arrival.
Precisely. Also, any significant amount of frank bloody discharge before the first offspring arrives isn't normal either and should be investigated.
Okay. And you mentioned something called the Ferguson's reflex earlier. What's that about?
Yes. The Ferguson's reflex is basically the natural involuntary urge to push or strain abdominally when the cervix and vagina are stimulated, like by a fetus entering the birth canal.
Right.
If that reflex seems weak, or if it's completely absent, even when you'd expect it, like during vaginal stimulation by a vet, it strongly suggests uterine inertia. The wiring for pushing isn't firing properly.
So a lack of that pushing reflex is another piece of the puzzle.
A very significant piece, potentially pointing towards uterine inertia.
Okay, so we know the warning signs now. Let's dig into the underlying causes.
Yeah.
Our sources break them down into fetal factors, problems with the puppy or kitten, and maternal factors, issues with the mother. Let's start with the fetal side.
Sure. Often it comes down to size. A fetus might just be too big, relative oversize, to fit through the mother's pelvic canal. That's a common one. Then you can have actual fetal abnormalities. Things like severe congenital deformities, sometimes referred to as monsters in older texts, or conditions like anasarca, which is extreme fluid swelling of the whole fetus, or hydrocephalus, water on the brain, making the head too large.
Right.
Interestingly, like we touched on, a prolonged gestation, often associated with just a single fetus, a singleton litter, can also cause dystocia. Maybe that one fetus doesn't provide enough stimulus for strong labor. And then, of course, there's abnormal presentation, position, or posture, basically. The fetus isn't lined up correctly in the birth canal.
Yeah.
Instead of head or tail first, maybe it's sideways or leg is back.
Malpositioning.
Exactly. And sadly, fetal death can also lead to dystocia, as a deceased fetus doesn't position itself properly for birth and doesn't trigger the right reflexes.
Okay, quite a list on the fetal side. What about the maternal factors? Seems like this could be even broader.
You're right, it's a very wide category. A huge chunk relates to inadequate uterine contractions. We mentioned uterine inertia primary, where it never starts strongly, or secondary, where it starts but then fades due to exhaustion, maybe a biochemical imbalance like low calcium or glucose, or even psychological distress like extreme fear or disturbance.
Exhaustion makes a lot of sense if labor drags on.
Definitely. Then, separate from the uterus itself is the mother's ability to push using her abdominal muscles, the abdominal press.
Oh, okay.
Even if the uterus is trying, if the mother is in too much pain, is terrified, generally debilitated, maybe has something like a diaphragmatic hernia restricting breathing, or is just very old, her pushing won't be effective.
So the uterine contractions and the abdominal pushing have to work together.
They absolutely do. Then there are problems with the uterus itself, things like infections, placentitis, metritis, endometritis, or physical issues like uterine torsion, where it twists or even rupture, neoplasia, which is tumors, cysts, adhesions from previous issues, all can interfere.
Wow, the uterus itself can have a lot of problems.
It can. And we also need to consider the mother's overall metabolic state. Conditions like pregnancy toxemia or gestational diabetes can impact labor.
Right.
And then there's the structure of the birth canal itself.
Right.
Any abnormality in the mother's pelvic canal may be from a previous injury, just her conformation or breed type, being too young and immature, or having a congenitally small pelvis.
Like in the corgis or brachycephalic breeds you mentioned.
Exactly. That creates a physical blockage.
It feels like almost anything could potentially cause an issue.
It highlights how complex birth is, and there's still more on the maternal side. Things like inguinal hernias, problems within the vaginal vault like strictures, septae, hyperplasia, cysts, tumors, issues with the vulva opening itself too small, fibrosis, even insufficient dilation of the cervix or just not enough lubrication.
It really is a whole cascade of things that need to go right.
Precisely. Everything needs to function correctly for a smooth delivery.
Okay, so we've covered the many cases. Let's quickly summarize the key risk factors that make dystocia more likely.
Sure. We've hit on breed a lot. Brachycephalic and toy dogs, Persians, Himalayans, Devon Rex cats, those are big ones. Age can be a factor. Obesity is definitely a risk factor. Abrupt environmental changes right around the time of birth can sometimes trigger problems.
Stress, basically.
Yeah, likely stress-related. And a really important one, a previous history of dystocia. If she's had trouble before, she's much more likely to have trouble again.
That makes logical sense.
Yeah.
Okay, so if you suspect dystocia, what happens next? How is it diagnosed, and what are the general treatment options?
Diagnosis starts with a really thorough physical exam of the mother. That includes a digital vaginal exam to feel for any blockages, assess the cervix, check fetal position if possible, and evaluate that Ferguson's reflex.
Right.
Blood work is usually crucial, checking things like PCV, protein levels, BUN, but especially glucose and calcium. Ideally ionized calcium, because low levels can directly cause uterine inertia.
Okay, checking the fuel tank, essentially.
Kinda, yeah. And then imaging is key. Radiographs, X-rays are great for seeing the number of fetuses, their relative size and position, the mom's pelvic conformation, and unfortunately, signs of fetal death like gas patterns. Ultrasonography is also incredibly valuable. It gives you real-time info on fetal viability. You can actually see heartbeats and measure heart rates, look for signs of fetal stress, check for placental separation, and assess the fetal fluids.
So exam, bloods, imaging to get the full picture.
Exactly. And once dystocia is confirmed, the general plan is usually inpatient care. Keep mom at the clinic until all the babies are delivered and she's stable.
Makes sense.
And treatment. Treatment depends heavily on the cause. If it seems to be uterine inertia without any obstruction or fetal distress, medical management might be tried first. But, and this is a huge but, you absolutely do not want to use drugs that stimulate contractions like oxytocin if you suspect any kind of physical blockage.
Why not?
Because you'd be forcing the uterus to contract harder and harder against an immovable object. That can cause placental detachment, severe fetal distress, or even catastrophically rupture the uterus.
Okay, so ruling out obstruction is absolutely step one before using something like oxytocin.
Paramount. If it is confirmed inertia with no blockage, treatment might involve correcting any calcium or glucose deficits first, then potentially very careful low-dose administration of oxytocin. Sometimes, if a fetus is stuck just inside the birth canal, manual assistance might be possible.
Manual delivery.
Yeah, using lots of lubrication and very gentle finger manipulation to try and ease the fetus out. Our sources strongly warn against using any kind of instruments, forceps, and the like, because the risk of injuring the mother or the baby is just too high.
Gentle hands only.
Gentle hands only. And if manual delivery doesn't work within a reasonable time, say about 30 minutes, then a cesarean section, a C-section, is typically the next step.
Okay. And when is a C-section the primary recommendation? Maybe even planned?
Several scenarios. If uterine inertia isn't responding to medical treatment, especially if there's still quite a few fetuses inside, like more than 4.
Right.
Any definite pelvic or vaginal obstruction. If a fetus is in a position that just can't be corrected manually, if a fetus is clearly oversized, any sign of fetal distress from ultrasound monitoring or evidence of fetal death in utero, and then, of course, elective C-sections. These are often planned for those high-risk breeds or animals with a known history of dystocia. Or maybe if imaging shows a single huge fetus or a very, very large litter is expected.
Planning ahead for known risks.
Exactly. It's often the safest route in those cases.
And anesthesia for a C-section must be tricky, dealing with a pregnant patient.
It requires special consideration, definitely. The enlarged uterus can press on major blood vessels affecting circulation, so positioning is important. Pre-oxygenating the mother before anesthesia helps both her and the fetuses.
Makes sense.
And the choice of anesthetic drugs is critical. You need drugs that provide good anesthesia and pain relief for the mom, but have minimal depressive effects on the neonates and can potentially be reversed in the newborns if needed. There are specific protocols vets follow.
A specialized procedure for sure. Now, you mentioned when oxytocin shouldn't be used due to obstruction. Are there other major contraindications?
Yes, absolutely.
Okay.
Besides obstructive dystocia, oxytocin is generally contraindicated if there are clear signs of fetal stress already.
Okay.
Also, if a fetus has been deceased inside for a long time, or there's any suspicion of the uterus being torn, ruptured, or twisted, uterine torsion. Using oxytocin in those situations could make things much worse.
So, again, accurate diagnosis before reaching for that drug is vital.
Cannot stress that enough.
Okay, so looking towards prevention, what can be done proactively to try and avoid dystocia?
A lot of it comes back to managing those known risks. For animals clearly identified as high risk, maybe they have pelvic abnormalities, known vaginal issues, belong to those highly predisposed breeds, or have that history of inertia.
Right.
Scheduling an elective C-section is often the most responsible and proactive approach to ensure safety for everyone.
But timing that elective C-section must be crucial. You don't want to take the babies too early.
Absolutely critical. Our sources really emphasize this. You need accurate breeding dates, knowing the day of diestrus, the LH peak, or ovulation to calculate the due date properly. This ensures the fetuses are mature enough, particularly their lungs, to survive outside the uterus when the C-section is performed.
And if the breeding dates aren't known for sure?
Then using ultrasonography to assess gestational age and fetal maturity becomes incredibly important before scheduling that surgery. You have to be as sure as possible that they're ready.
Makes perfect sense. And finally, what's the overall outlook? The prognosis when dystocia happens?
It really depends on timing. If dystocia is caught early and the right treatment is started quickly and effectively, the prognosis for the mother is generally good to fair.
Okay.
And the chances for the puppies or kittens surviving are usually fair as well in that scenario.
But if it's delayed?
That's where things change dramatically. If dystocia goes unrecognized or isn't treated for, say, 24 to 48 hours, the prognosis for the mother drops to guarded or even poor.
Oh, dear.
And tragically, the likelihood of fetal survival becomes very low. It really hammers home how time-sensitive this condition is. Prompt recognition and action are key.
So wrapping this up, it's crystal clear that dystocia in dogs and cats is, well, it's a really complex issue. So many potential causes. And being able to spot those early warning signs we talked about is just absolutely vital for getting a good outcome for mom and for the babies.
Couldn't agree more. And while we've covered a lot of ground here in this deep dive, it's so important for you, our listener, to remember this is for enhancing your understanding.
Right.
If you actually suspect your pet is having trouble giving birth, the absolute most critical thing is to contact your veterinarian immediately. Don't wait. They're the ones who can provide the necessary timely care.
Absolutely essential advice. Hopefully this discussion has given you a really solid foundation for understanding dystocia better and maybe helps you feel more empowered to ask informed questions if you ever need to discuss this with your vet.
And that leads us nicely into our final thought for you to ponder. Given what we know about breed predispositions, pelvic conformation, uterine inertia, and all these risk factors, What are the important ethical considerations around breeding practices, and how can responsible breeders and owners best prepare to minimize the risks and ensure timely intervention when needed? Something to think about.